Dear members, dear participants of the International Interactive Conference Digital Health, which is organized the third time, and we are so glad to see you in such a comfortable atmosphere. And our speaker of this session, Ruthy Kaidar, Director Health Industry Sector, Central and Eastern Europe, Microsoft. Hello, Ruthy.
Hello. How are you? Good morning, good afternoon.
Thank you. So you are welcome, and we have the theme of your presentation, Reimagining Healthcare.
Yes, absolutely. So it's a really great honor to be here. There's actually never been a more interesting time to watch the transformation of healthcare.
Yeah.
To see healthcare is evolving and to feel the real challenges that the healthcare industry is facing and how we can solve it. I'm Ruthy. I'm the director of the health industry sector in Central and Eastern Europe. I am very delighted to talk to you about the transformation of healthcare and how can we all strive to create better insights, better experiences, and ultimately to be leading to better care for our patients. I want to start with a Microsoft mission. Our mission is to empower every person and every organization on the planet to achieve more. This is really our North Star at everything we do. It's how we show up, how we build our products, how we talk, to our customers, our partners, and even, within our company, to our colleagues. Basically, it's just not just a set of words. It's really to us talking about how we empower people, meaning how do we use the right tools that anyone, anywhere in the world can become anything they want. And this is even stronger and, comes to play daily when it comes to healthcare. So we've worked with thousands of organizations on their digital transformation, healthcare organizations, but, other industries as well. And we've learned that a transformation journey is not a one time or 1 week or an immediate thing. It's really a process. It's a journey that organizations and any entity really needs to understand what they need to do to support their people and the organization in order to bring this transformation. It has 4 pillars. The first pillar starts with a vision and strategy. Where's my vision? Where do I want to be? What is my strategy of this transformation journey that I'm going on? Second is culture. How do I create an inclusive culture around me that allows for the transformation to happen? That allows for different opinions or brainstorming or just having different people on the team that are new to what we're used to having. This plays a very important role at Microsoft, where we're in a mode more and more going into a growth mindset mode, an inclusive mode where, we're constantly trying to find new ways, new things to learn and to include more opinions and more people in anything we do. The third pillar is a unique potential. I worked for startups and specifically for digital health startups for many years. I founded 2 startups and I was even in the investment space in the digital health world in Israel. I'm based in Israel. And I always say to startups, what is your unique value proposition? What is it? What is it that makes you unique that a customer will choose you? And this is true for an entity, for a ministry, for an organization, but also for an individual. What is unique about me that brings forward and empowers people and helps? And finally, it's capabilities. What are the technologies? What are the tools? What are the resources that we need in order to make that transformation happen? What are the trends that we're seeing in healthcare? As we look, we're almost at the end of 2020. So first of all, there is what we call the consumerization of healthcare. Patients want and expect that the health institutions to have full access to their medical history. They want what we call 360 view of their health. They want insights, they want prediction, they want trends, right? They want the healthcare to be around them. The second thing is data. There's a huge amount of data in healthcare. There's 4 trillion gigabytes of healthcare data generated annually, and this doubles every 2 years. When you have data, you need to analyze this data. You need to introduce artificial intelligence. Accenture expects that the AI in healthcare market is going to be $6.6 billion in revenue or market value by 2021. At the same time, healthcare is a lot about regulation. It's about a lot about compliance, a lot about security. The healthcare industry lost $6 billion a year due to data breaches. So that means that any health organization, while going forward and striving towards innovation, always needs to keep in mind end-to-end security and compliance. And finally, skilled workers. 55% of healthcare executives say that they lack the skilled teams in their digital transformation innovation journey. That means not only doctors, nurses, and healthcare individuals, it means also data scientists or people who understand AI or just software, because there is that convergence between technology and cutting edge technology and healthcare. And this is where we need skilled workers. COVID has, created disruption and challenges. And what we see in the healthcare industry is, first of all, that 70% of elective procedures were canceled or screenings were paused. Actually, 200,000 cancer screenings are paused each week in Great Britain's NHS. It's one of the biggest hospital chains in the UK. Do you understand the impact that makes, first of all, on the patient's health, because they'll get, diagnosed later, and eventually on their care? This situation where, there's a lot of new information coming in created a lot of need for collaboration. A lot of healthcare organizations are collaborating more. Even, you see mergers and acquisitions between healthcare entities in order to move forward and thrive. And finally, we're all deep, in our coping with the COVID pandemic. And we're in a mode where we're past the initial crisis, and we understand, okay, we need to manage this. And we also need to think, how are we reinventing ourselves? Because healthcare is going to change. And how do we reinvent ourselves to ensure a successful future for healthcare? Mm-hmm. What happened in the beginning of the COVID pandemic is a lot of our customers came to us and said, we need your help, please. We need doctors to be able to talk to patients, at their home now. We need doctors to be able to access their data of the patient now, from home or from anywhere. We need to have a ward that doesn't require a lot of care people to enter it, because we don't want to risk, any contamination or any sickness of the care teams, right? We don't want to protect them because we need them, because we're going to have so many people to take care of. How can technology help us? And then what we found ourselves doing at Microsoft is, okay, we have a few modules here that can help you, and we have a few modules here that can help you. And we started putting things together. And we realized that actually, if we put everything together, we can help our hospitals, ministries, or any health entity to accelerate transformation, because they need the solutions now. They can't wait until something new is developed. So what we did is we took, the building blocks that are relevant to healthcare from our main clouds, from our main products like our Microsoft Azure, our Microsoft Dynamics 365, which is our business application cloud, or our Microsoft 365, which is our productivity cloud. And we added that to that partner solutions. And together we built a healthcare cloud. It's the first industry cloud, and it actually has the modules that are healthcare related that can help organizations and healthcare entities transform fast. Mm-hmm. What we saw while working with all these customers is that there's scenarios that are coming up from many of our customers that we actually need to treat as the main scenarios that they need help with, that technology can bring solutions. So whether it's enhancing patient engagement, we talked about that consumerization of patient health. How do we create an experience that gives people control over the health data? So take, for example, Regina Maria, which is a chain of hospitals in Romania that immediately understood that they're going to need to have remote health. And they created what they call a teleclinic, right? The ability to have a complete clinical experience through Teams, which is a Microsoft product, but through any technology, right? Video, recording, transcribing, connecting that to a health record, having that whole experience that the doctor does when you sit in front of them in the office, but on technology. Or a health bot, right? I mean, we all hear about health bots. We do have a unit at Microsoft that's called AI for Health. And what they did, they worked on a few various technologies even before the pandemic started. And suddenly they realized that a health bot they were working on is actually one of the best uses, can get one of the best uses during COVID. Why? You put a health bot, a lot of the questions, a lot of the information you want to give people is the same information, but you need to make sure it reaches everybody. Introducing a health bot that answers the main COVID questions, asks you even about diagnosis or symptoms, and turns you to the right channel in order to get the best care, can reduce 50% on customer care call center volume. It can reach even 70% of one customer in the US. So that on its own can allow the care teams and the health entities to focus on the care. The second scenario is empowering care teams. Here we want to make sure that the care teams are well connected, that they can securely share information with each other so that they have more time with patients, less time on administrative work and more time with patients. More time with patients is better care. The third is improving clinical and operational insights. How do we take all that data that we talked about, right? And analyze it, understand what it means, understand how do we act forward, right? Whether it's the Australian government Department of Health that used this in order to understand what procedures are happening where, what should be our planned budget for next year, in order to be able to really base our decisions on data. The fourth is protecting health information, making sure, right, especially when you introduce more technology, you need to make sure that everything is secure, that everything is compliant, that the data remains private. So how do we ensure that end-to-end security, even if it involves home care and remote care? And finally, it's about reimagining healthcare. What is the future of healthcare? What does it look like? What is a care going to look like? What is the development of a new drug going to look like? I want to share a few videos with you. The first one is really about a hospital in the UK that came into the COVID pandemic and realized that they need to make a change immediately, and that in order to be able to treat all the patients that will come in due to COVID, they need to introduce technology. And they introduced mixed reality in their fight against COVID. Let's take a look. So introducing that mixed reality technology had to happen immediately. That means you need to use technology that is ready and that is configured towards a healthcare environment. The other case study I want to show you a video about is Novartis. So we talked about reimagining healthcare. Novartis is one of the biggest drug or medicine developers in the world. And, developing medication, even what we see now around, developing a vaccine or any medication that can help cure diseases, requires a lot of research, a lot of time, a lot of resources, and eventually a lot of data. How do we use the technology that we have now to harness all the data, to expedite development, to expedite scientific innovation, and help the people who are developing these medications to get to better results and faster? Let's look at the video. So absolutely amazing to see how you can empower people, you can empower processes, and eventually really bring better medication and better care to the world. And finally, I want to end, I want to first leave you with, finally, I want to show you one last video. This is a strategic collaboration that actually started again around COVID and around an initiative to accelerate the drug discovery as part of the digital transformation that UCB went through around COVID. Let's watch. I want to leave you with 3 questions that you can ask yourself, taking out of this digital health conference and discussion. What does successful healthcare look like for you? And what are your current healthcare challenges? And finally, what do you need to transform? Thank you very much.
Yeah, thank you for your presentation. It was so interesting. And Ruthy, you said about Microsoft's perspectives for healthcare in general. And can I ask you about Microsoft's perspective in Kazakhstan, in our country? We are here now.
So look, I mean, Kazakhstan is a very important country for us. We have presence in Kazakhstan. We have a team there. They're working very, very closely, both with, the government entities and with commercial companies in Kazakhstan. We have the power of Microsoft is that we have that presence across the world, and that we can have the people in the country and bring in a lot of more people, whether it's technical people or business people, in order to help any country and any organization in that country go through their digital transformation, go and develop towards the future. And really, I think that the local team and the ability that we are there and that we're presenting even in this conference is because we can bring the whole power of Microsoft to empower and to bring forward that innovation.
Thank you. So, and now, how is the situation, COVID situation in your country? Is everything okay, normal?
We're in the second wave. We're probably towards the end of the second wave now. We were in lockdown for a few weeks, and we're coming out of lockdown now. So like all countries, we're experiencing very similar. So, I don't think anybody kind of solved it in a way that others haven't. I think we're all in the same boat. I think that's pretty unique for this situation, because I think many countries are looking at each other, comparing best practices, sharing data, sharing methods in order to get over the pandemic and still keeping, the population healthy, keeping them healthy also mentally, keeping our kids healthy, and allowing the economies to thrive. So I think it's a common kind of worldwide goal that we have now. And I wish really health and success to everybody across the world, especially in Kazakhstan.
Thank you. Ruthy, we just want to say thank you for your information, for your time, for this interview. Yeah, it was very interesting. And be healthy. Be healthy, the main wish nowadays.
Exactly. Keep safe and be healthy. Thank you very much for having me. I appreciate it.
The speaker of the Digital Health Conference is Ruthy Kaidar, Director Health Industry Sector, Central and Eastern Europe, Microsoft. Dear participants, dear members, we will see you on the next session. Goodbye.